Hello friends, today we'll talk about this brain-eating amoeba. This infection has been recently reported in larger numbers from the state of Kerala. So first of all, what is this infection? So this infection is caused by an amoeba, as the name suggests, Amoebic Meningo-encephalitis, and there are two common organisms. One is Naegleria and other is Acanthamoeba. Now the second thing is it a new infection? The answer is no, it has been there for several decades. In my initial days when I was at CMC Vellore, we used to see these infections, not commonly, but it was a rare infection then also, and it has been reported from other parts of the country as well as other parts of the world also. So it's not something unique to Kerala alone. Then the next point is, what are the common symptoms that people with this infection can have? So in the initial period, it can be like any other brain fever. So they can have fever, headache, and vomiting. But as the infection becomes more severe, then the patients can become disoriented, confused. They can have seizures or convulsions, and they can also develop focal weakness of arm or leg, and finally they can become comatose also. And then how does this infection occur? So basically these infective agents are found in fresh water like swimming pools, ponds, lakes. So if people go there to take bath, or if they are diving or swimming, then the infected water can enter the nose, and in the nose we have the olfactory nerve or the smell nerve, and the nasal cavity is separated from the brain by a small thin bone that is called cribriform plate of ethmoid. So sometimes the infection can travel through that and enter the brain. So definitely the infected water has to enter the nose and through nose to the brain for a person to get infected. There is no other known source of infection. So even if the water is infected and the person by mistake drinks that water, this infection will not happen. Second is person to person. So if a person is infected, then another person comes in contact with with the infected person, they will not get the infection. So, and then is there a real increase? So yes, there has been a recent increase in the number of cases compared to what we normally see. But the reason for that may be greater awareness and more advanced facilities in Kerala for detection and diagnosis, and there could be a real slight increase in the numbers also. And uh, and then how do we confirm a diagnosis? So basically, once somebody has symptoms like as I mentioned, then we need to do a scan. Scan may not show any specific findings. It may show increase in the cerebral edema, what is called as brain swelling. But subsequently, we need to do lumbar puncture, where a needle is inserted into the lower back, and then the cerebrospinal fluid or the CSF is examined, and that can show the infective organisms on the microscopy. And then there are other techniques to confirm the infection. Sometimes the brain tissue also can be used for diagnosis. And but once we confirm the diagnosis, is there any specific treatment? Unfortunately, there is no proven and effective treatment, and as a result, case fatality is very high. In of all the reported cases, if caused by Naegleria, almost more than 95% people die. But the good news is that in the Kerala cases, the fatality is only about 20 to 30%. So it is possible that once we diagnose the infection early and they get the best care, then deaths can be prevented also. There are some medicines used to treat this infection, and also supportive care, ICU care, treatment of seizures. All these things can help in a person survive this infection. So since we do not have any effective treatment, uh, we have to only take the preventive measures and try and do everything possible to avoid this infection. And that means minimizing the exposure to water which is in public places like swimming pools, or say freshwater lakes or ponds. And also government is taking their own steps of chlorinating the water and making sure the water is not contaminated. And there are some people who do this ritual where they use water to rinse their nose, which is not correct. It should not be done. In the rare cases, if somebody has to do it, they should use totally sterile water for it. And then, so by taking these precautions to ensure that the water, infected water, doesn't enter the nose, one can reduce the risk of getting this infection. And so here, as I mentioned, we have to focus on the prevention, as there is no effective treatment.